I'd like to welcome everyone to what has become anyways, the annual North Central Legislative Forum on Mental Health and Substance Abuse. My name is Ken Ritchie. I'm a mental health volunteer. We're pleased to have the audience as well as our legislators and others with us today. Of course, last year, all of our smiling faces were on Zoom, but this year we get to do a little of both, a little in person. We have some folks online as well. The forum actually has become an opportunity for our local mental health and substance abuse organizations to inform legislators and the public about the most pressing issues of local interest, but also an opportunity for legislators to give their viewpoint and comments, and an opportunity for the audience, those in the audience, to ask questions they might have. Our commitment, even though we get a bit of a late start here, is to end by 8:00 p.m., okay? The order of things, after I introduce the legislators, we'll have a presentation, and we're gonna have a personal story. Then we'll give our legislators an opportunity to make comment, followed by questions from the audience. Finally, then we'll give our, what we call a call to action, which is, it outlines the legislative priorities that the members of our forum committee believe are most pressing. Okay, a word to the audience about questions. If you have a question, you've been given, I believe you picked up a piece of paper as you come in the door where you can write your questions down, and we'll collect those. And also for those online, you can put any questions you have in the chat. One thing about it, we'll ask as many questions as we have time to ask. And so we're not real sure how many that'll be. We'll do our best to try to do what's appropriate. Oh, one other thing, as has been the practice for some time, we will not be addressing legalization of marijuana at this forum. Okay, I have to say that every meeting. So anyways, to begin, I'd like to introduce our legislators alphabetically, those who are here. First of all, I'll start with Ron Alting. And Senator Alting represents Senate District 22, which includes the southwestern part of Tippecanoe County. He's the chair of the Senate Public Policy Committee. Next is Senator Phil Boots. Senator Boots represents Senate 23, and it seems like he represents the world. There's so many things there. He includes all of Fountain County, Montgomery County, Park County, Vermilion County, and Warren County, and a part of Boone County. He's the chair of the Pensions and Labor Committee and also serves on 4 other committees. Senator Boots has served since 2006 and has decided to step down after this term. So a big thank you for your service and to our community as well. The next is Representative Sheila Klinker. Representative Klinker represents House District 27, which includes the city of Lafayette and the eastern portion of the city of West Lafayette. Representative Klinker serves on the House Ways and Means Committee and also serves in 2 other committees as well. We also have with us, actually he'll be here shortly, will be Commissioner Tom Murtaugh, and I'll recognize him once he gets here. We also have with us a couple other folks, John Fry, who is with the Montgomery County Commissioner's Office, and so we're pleased to have you with us. And also Mark Dowd of the office of Senator John Braun. So I got that wrong. Mike Braun, 2 of them. Mike Braun, yeah. So glad to have you with us as well. And so I'd like to thank each of you for, I know it's a busy time of the year, busy time, and yet you take out your valuable time to participate, and we appreciate that. Mental Health America recently published a report entitled The State of Mental Health in America. The report evaluates and ranks each state in the United States. Indiana is ranked in the lower half of states in the U.S. in this latest report, dropped once again, this time from number 38 to number 42 out of 50. So in the overall ranking. So we continue to have a lot of work to do in addressing mental illness in our communities. This evening's forum features a presentation by Dr. Nicole Adams. Dr. Adams is with the School of Nursing at Purdue. She conducts research focused on collaboration, on community responses and collaborations addressing the opioid crisis, substance abuse, and also mental health. She's mapped out the mental health system in several areas of our state, and very recently mapped out the mental health system in Tippecanoe County. Her talk, however, this evening will focus on mental health services within the state of Indiana, especially those mental health services which do not meet the current need. So I am pleased to be able to turn the podium over to Nicole Adams.
Thank you, Ken. Thank you, everyone, for inviting me to speak today about the status of mental health in the North Central region and actually the state of Indiana. So first, we're going to talk about parity. What is parity? The definition of parity is a state or condition of being equal, especially regarding status or pay. So we're going to talk about the tale of two conditions. So first, we're going to talk about heart disease. Any Hoosier, this is anybody in the world, in our state, may have some risk factors like lifestyle, genetics, and their age that could predispose them for heart disease. Now, they may hear something on the radio about a heart scan, and they might start thinking, you know, I'm a little short of breath sometimes, and I have a little bit of twang in my chest sometimes. Maybe I should get one of those heart scans. So that heart scan, they get in real quick, they get their heart scan, they get referred to cardiology. Maybe they skip the heart scan and go straight to the cardiologist. It takes about 2 weeks for them to get in. So the cardiologist may put them on medication, send them for some additional testing, send them to a dietitian to help them with their lifestyle. After they put in all the hard work that goes along with this, they end up with a long life and a healthy heart. Let's talk about any Hoosier, again, with the same risk factors of lifestyle, genetics, and age. They're having that shortness of breath. They're having that little twinge in their chest, and they call for a heart scanner to see a cardiologist. But instead of 2 weeks, it takes 6 weeks. So they said, forget it. I'll just go on. So instead, they have a heart attack, and they may die, or end up in the ER, which is very costly, in a very expensive ambulance ride. They end up in the cath lab, in hospitalization, and long-term heart damage, because they could not get access in a time that they felt was reasonable. Let's talk about anxiety and depression. So once again, we have any Hoosier. They may have some predispositions to anxiety and depression. This can include, on a slight side, lifestyle, but also genetics, and really, really impactful, a previous trauma in their life, including adverse childhood events. They decide they are having this anxiety and depression that's getting in the way of them doing their life and taking care of their family, so they call for a therapist or a psychiatrist. And they get in 2 weeks' time. The therapist and psychiatrist may refer back and forth between each other for medication and therapy and counseling. They get counseling services, medications, they get referred to support groups. Once again, they put in all the hard work it takes to recover, and they lead a healthy, happy life. Let's talk again about any Hoosier with the same risk factors. But when they call for the therapist, it's 4 to 6 weeks. When they call for the psychiatrist, it's 4 months. So they can't get the help they need, and instead they take another path to a mental health crisis, which can lead to suicide and death. Or they could end up going to a hospital and getting an evaluation. They could end up in the ER for an evaluation. They could have a lot of personal loss along the way, like their job, their family. They could turn to a life of crime. They could go to jail. If they're arrested, they may end up in the ER by law enforcement path. After they're evaluated and they have their ER visit, they could end up in a partial hospitalization or intensive outpatient, so home-based, long-term acute care, so every day going to see a therapist, or they could end up in a very costly inpatient stay. which leads to long-term damage to their lives. This has all been made worse by the pandemic. So prior to the pandemic, there were about 1.125 million Hoosiers that reported mental illness in the past year. Before the pandemic, 7.3% of adults needed and did not receive treatment for mental health. That comes to 367,000 Hoosiers who could not get the help they needed. 8.3% of Hoosiers in Indiana had a major depressive episode in the past year. That's 418,000 Hoosiers. And in Tippecanoe County, after 2 years of decrease, there was a slight increase in suicide deaths in 2020. So we went from 2019, 22 suicides, to 23 in the year of 2020. Post-pandemic, it's a worse picture because that's not a great picture to start with. But then we move post-pandemic. More than 1/3 of adults report anxiety or depression. That's 2.59 million Hoosiers who have anxiety and depression. We have 497,000, almost 500,000 adults report being unable to get counseling. In 2020, there were 32,714 calls from Indiana to the National Suicide Prevention Hotline. This is in addition to 6,380 calls that went to 211 to their Be Well line from July to December alone. So far this year, 211 has gotten over 20,000 calls for mental health. In Tippecanoe County, the suicide rate for the first half of this year is 111% higher than the same period in 2020. That is 19 suicides in the first 6 months of 2021 alone. So the effects of the pandemic are not just 2020. We're feeling them this year. What about our youth? We're all very concerned about our youth growing up healthy and happy and being productive. Well, pre-pandemic, about 16.6% of adolescents had a major depressive episode in the past year. That's about 89,000 young Hoosiers. Post-pandemic, over half, 54% of kids aged 12 to 17 with depression did not get care. It's a complex system. This is the kind of map that I produced. I'm not going to talk a lot about this. It's very complicated. It can be hard to follow. It's the maps we use in our community collaborations to try and pull together our organizations and maximize what we have to provide the care people need. But it's not enough. So many of you toured Tippecanoe County Youth Services last May. Counseling, we have counseling services, but they're very limited. And they often require school absences because they're not provided in school. So kids miss class to get the counseling that they need. There are some school-based services provided by Valley Oaks. However, they're limited to only certain Medicaid plans. We have inpatient, or intensive outpatient and partial hospitalization programs. So those are the day treatment programs through changes. But we have no inpatient. The nearest is in Indianapolis. And many of us in this room, hopefully, can afford to fill the car with gas at these really high prices. But many people whose children need that inpatient stay, the struggle is for them to put the gas in the car to get to Indianapolis, especially if it requires multiple trips. So adult services, we have counseling. It is, there are limited providers accepting Medicaid due to reimbursement rates. Many of our independent providers can only accept commercial or self-pay, and they cannot afford to accept the rates that Medicaid is paying. Psychiatric services, it is up to a 4-month waiting for an initial evaluation for severe psychiatric illnesses. We have intensive outpatient and partial hospitalization. However, that reimbursement has fallen so low from Medicaid on the partial hospitalization that it costs more to provide the care than the reimbursement. So that many places cannot afford to offer that anymore to Medicaid patients. So hospitalization for adults, inpatient only, we have 64 inpatient beds in Tippecanoe County between 2 facilities. Our average length of stay is about 8 days. And about 70% of inpatients are able to get scheduled for follow-up within 7 days as required. So the law says that you have to have a follow-up within 7 days. That number should be 100%. But because of the limited outpatient providers, they are not getting those referrals completed. Those delays lead to relapses and readmissions and even higher costs. To put things into perspective, the state hospital is $1,573 per day to have somebody in the state hospital. That's what the state pays for those hospitals. Hospitalization is expensive. We know that. It's expensive in medical care. It's expensive in psychiatric care. But there's not parity in how the reimbursement is done. So for an acute hospital stay, that's a medical stay for heart failure, the average is 4.6 days, and it's $10,232. This is the national average for a 5-day stay for heart failure. Our Indiana Medicaid reimburses at 46.7% of the national average cost. For a psychiatric hospital, the average is 7 days, and the national average is $6,973. For 5 days for depression, Medicaid reimburses $2,042. So Medicaid pays 29.2% of the national average cost. So just over half of what they reimburse percentage-wise for medical care, for psychiatric care. So we can't talk about mental health without talking about the justice system, because a lot of people with mental illness end up involved in the justice system. About 40% of Hoosier adults in jail or prison have mental illness. Now, 40% actually sounds not that bad, considering we've heard much higher numbers. But we're not including people who have substance use. When you include substance use, the estimates are between 65 to 85%. And a lot of substance use is driven by mental illness. However, this is for people who have had previous diagnosis of mental illness and no substance use. We have 40% of people in jail fall into that category. About 70% of Hoosier youth involved in the juvenile justice system have mental illness or a mental health condition. 70%. 25% of people with a serious mental illness have been arrested in their lifetime. This represents 2 million incarcerations per year, and that's national. So let's talk about how we pay for care, because we've talked a little bit about how the reimbursement works and about the different pathways and expensive care and less expensive care. So Medicaid, statewide, 37.2% of adults on Medicaid report mental illness. This is compared to 19.8% of adults with commercial insurance. So there is a greater percentage of people who need mental health care on Medicaid than in privately insured plans. In Tippecanoe County, it's a 4-week wait to counseling service regardless of your insurance. You can get in 2 weeks if you're willing to pay cash with an independent provider. In Tippecanoe County, it is a 4-month wait for that evaluation by a psychologist or an advanced psychologist or a psychiatrist if you have a known diagnosis or a severe mental illness. 4 months. So what's going on with psychiatry? Why are we looking at 4 months? So psychiatric residency numbers, if anyone doesn't know, are set by Congress through Medicare funding. There were 1,904 residency slots in 2021 matched, which represents only 3 slots, 3 residency positions that were not taken. This is national. If we were to divide those students in 5 years when they finish, those residents, among all states evenly, it would average out to 38 residents per state. However, we know that the psychiatrists do not distribute themselves evenly across the country. So in Indiana, 35.8% of our psychiatric workforce need is met, just over a third. The state needs 197 additional psychiatrists to meet national standards. If you look at the IU School of Medicine website, and they have a residency in psychiatry, there are 2 doctors finishing in May. Psychiatric mental health nurse practitioners have grown threefold between 2010 and 2015, and they continue to grow. Between Purdue and IU, there are around 30 psychiatric nurse practitioners graduating every year. Nationally, 60% of psychiatrists are over the age of 55. And over 50% do not accept Medicaid or even commercial insurance. In Indiana, I believe we're around a third of our psychiatrists that accept Medicaid or don't accept Medicaid. So we're better in Indiana than that number. So psychiatric mental health nurse practitioners can prescribe, they can diagnose, but they have to have a collaborative agreement with a psychiatrist, which requires them to review 5% of their charts every 7 days. So a single psychiatrist can only take on so many nurse practitioners because of the work of reviewing the charts. So 24 states and the District of Columbia allow nurse practitioners to practice fully independently without collaborative agreements with physicians. NPs are also more likely to work in rural areas, underserved areas, and with vulnerable populations. The care quality and patient outcomes have been positive, and broadening scope has been associated with improved mental health outcomes. So these are studies that have been done over the concern that psychiatric mental health nurse practitioners do not provide the same quality of care as physicians, psychiatrists do, and the studies show that psychiatric care improves when nurse practitioners are independent because they're allowed to treat all the people who are on waiting lists seeking care. So that is, and I do not want to say that we don't need psychiatrists, that we don't need physicians, we absolutely do. But we are in a crisis state in the state of Indiana with our mental health care. The pandemic made a bad situation twice as bad, and we have to take some bold action to be able to address these gaps in our providers. Thank you.
You're not gonna ask us to fix that, are you?
That's the reason we're here.
I know. That's what this is all about.
Okay.
It's gonna take an army, not just us.
And of course, you'll get your opportunity. But again, anybody in the audience, as a result of that, have some questions or anything, please write those down. Now, when we talk about, of course, we've had the presentation and so forth, and of course, we can get information and so forth. But one thing I have learned over the years that we've held this forum, one of the more, I think, insightful and powerful things are stories that we hear. People who, with a mental illness, gone through the mental health system, and those stories can be so powerful. And fortunately, tonight we do have a story. And so we're privileged to have somebody step up and talk about their particular story. So I would ask at this time for Nancy Winningham to come to the podium. Thank you.
My name is Nancy Winningham. My husband, Mark, and I lost our son, Ian Winningham, to mental illness. I would like to tell you a little about Ian. Ian was a loving son, brother, and friend who had a huge heart and loved to laugh and tease his sisters. Ian graduated from Central Catholic High School and attended Indiana State University. Between college, Ian had worked at Arnie's in Lafayette. He'd also worked at Ace Hardware and Rural King prior. As a devout Catholic, Ian had a boundless love for God. He was a lifelong member of St. Lawrence Catholic Church and accompanied the choir with his passionate drumming. His love and passion for music was evident to all who attended the services. Ian was an altar server and played music there for 11 years. At age 7, Ian joined Chai Taekwondo to learn martial arts with his father, Mark. Ian reached the Chodambo level. Ian loved being outdoors. He loved plants and gardening. And when Ian was 13 years old, he had a huge garden. Ian had an enormous appreciation for his Native American culture. Ian danced and dressed in Native regalia. He was the junior headman dancer for the National Center for Great Lakes Native American Culture Powwow in Portland, Indiana, for several years. In 2004, Ian attended the grand opening of the National Museum of the American Indian in Washington, D.C. Ian attended numerous Native American art classes over the years, including drum making and beadwork. He also taught children about the Native culture. Ian earned the rank of Eagle Scout during high school and attended American Indian Scouting Association youth conferences through Boy Scouting. Ian was on the ASA Board of Directors as a youth member for the 2008 Idaho Youth Conference, and in 2007, at only 14 years old, Ian earned the John Provost Youth Award, Silver Medallion, the highest youth award at the ASA Youth Conference in Ada, Oklahoma. Ian studied music performance and music business at Indiana State University, and he participated in marching band, pep band, and jazz ensemble. As an incredibly talented musician, he aspired to be a professional percussionist. He attended a 3-week ISU student trip to Thailand to study percussion, as well as an ISU trip to Los Angeles, California, to the NAMM Music Trade Show. Why am I telling you all of this? Because Ian was a very smart, talented young man who participated and gave back to this community. He didn't have to die. If Ian hadn't slipped through the cracks of the mental health system, he would still be here. In high school, Ian was diagnosed with ADD. He attended counseling, tutoring, and was prescribed medication through providers locally. Then after Ian turned 18 with HIPAA, as parents, we often found it difficult to help Ian, the same as we did when he was under 18. After he went away to college in Terre Haute, we found a good prescriber there, but it was difficult when we came home. The local facility Ian attended no longer had a regular prescriber on staff. They were rotating ones with appointments spread way out. We tried a local GP who didn't seem to understand ADD. He told Ian he could take medications differently than he had been told before. Ian started dating a girl who he knew while he was at college. They dated for 3 years. Their relationship ended suddenly, and Ian was devastated. His schoolwork suffered. The doctor seemed to think the event triggered a brain disorder. Eventually, he had 2 different stays in 2 different facilities to get help. I continued to get him help working with the psychiatrist in Terre Haute. He told us Ian had psychosis and needed medication immediately because the sooner you treat it, the better the outcome. Ian started on medication for a while and seemed to improve. He continued to attend ISU, but like many people on medications for mental health, they stop taking them either because they feel better and they think they're okay now, or they don't like the way it makes them feel. We had no idea Ian wasn't taking medicine at first. We took Ian to his psychiatrist appointments driving to Terre Haute. I even drove him to a counselor in Indianapolis every week. Ian always said he was fine, even though he cried often, almost daily. I was terrified to leave him alone. He had an apartment locally one summer. He worked at Arnie's then. And then eventually I drove him back down to ISU to help him set up an apartment in Terre Haute. I constantly thought he might take his life. When Ian came home one weekend, he tried to see the old girlfriend. She had him arrested. He didn't try to harm her. He had just tried to contact her. She had a no contact order since he had tried to still contact her. So Ian was picked up and then taken to jail. He spent over 3 months in jail. Ian was bailed out. We had hired an attorney, but Ian sat in jail because he was so sick. He didn't understand that he needed to sign papers and do certain things to get out so we could get him mental health help. His doctor in Terre Haute said he needed injectable meds and even knew what kind to use. Here we have our beautiful, talented, kind son in jail. He has a diagnosis. We even know what medicine he needs, but we can't get him help. Ian just didn't understand. He was too sick to know what he needed to do. Why was he even in a jail? He was sick with a physiological brain disorder. Why can't we get him help? Our son didn't belong in jail. This is criminalizing mental health. I wrote a letter to a judge on Ian's case. The judge finally did allow Ian to be released to our custody to take him to a local facility to hopefully be admitted for an inpatient stay. But the facility said Ian didn't meet the criteria. They wouldn't admit him. We had to follow the judge's orders and return him to jail. Our hearts were broken. We had such high hopes. Now our son will get help, only to be returning him to a place where he didn't belong. Ian just got worse and worse in jail. I had tried everything to figure out how to manage the situation on my own. I couldn't do it anymore. So I called NAMI and talked to Sherry Moore. She put me in touch with a local case manager who went to see Ian. Eventually, after several visits, something made Ian listen to the case manager and do what he needed to do to get out of jail and home with his dad and I. Ian had to wait, though, for an opening to be evaluated at a local facility. He couldn't be seen immediately. Every day we were scared. Ian and I have always been close, so he knew I always tried to help him. Even though Ian didn't think anything was wrong with him, he promised me he would go to be evaluated and he would try injectable meds. He always listened to Mom, and there was something still inside him that was still the Ian we knew. He was trying to hold on. Why didn't we take him to an emergency room? Ian continually denied anything was wrong. They don't admit people unless they are a threat to others or themselves. When your child is over 18 years old, they don't listen to the parents like they did before. They could only go by what Ian stated. We had to wait for the evaluation, and after the evaluation, we had to wait for another appointment with a prescriber. In the meantime, I took Ian to another local facility. They had us wait hours to tell us Ian needed outpatient treatment, no meds prescribed. It wasn't what he needed, but it was something. I told them some of the things he was telling us that didn't make sense during the evaluation. I stated what his diagnosis was. I had paperwork from his doctor stating this. They said, "We have to go by the patient statements, ma'am." So Ian did Zoom meetings twice a week. Ian's dad took him to go apply for jobs. With COVID and now a jail record, Ian didn't find work. Every day his dad and I prayed, how much longer can Ian wait? At this point, Ian was running around with headphones on all the time, trying to block out things his mind is saying constantly. We would hear him say, "Shut up." I prayed every day that God would help our son. We were doing everything in our power, but the system was failing us. On January 11th, 2021, our lives changed forever. I had spent them all morning on the phone with Ian's case manager, discussing plans to help Ian. I hung up the phone, looking for Ian. Rise and shine, sleepyhead, I thought. He wasn't in his room. I started looking everywhere. I walked through the dining room and I looked through the window. I saw Ian hanging from a tree in the backyard. Our handsome, talented, kind, loving son took his life. I tried everything to help him. It failed. Why? Why did this have to happen? Why? No one seemed to understand. We needed help now. The ones who did understand said their hands were tied. No providers, rules that don't listen to parents at the certain age. When they know that mental illness doesn't show up mostly until after the age of 18. No beds available. Doesn't meet criteria. Police who have to pick up and jail people who really need mental health help. You know, I don't understand how we can have an actual diagnosis and need meds, and we had documentation that said our son needed this, yet now our son is gone. There are people every day with diagnosis of bipolar or schizophrenia who might just need medications and help with life management. They have a physiological brain disorder, but yet they are picked up and taken to jail and no one seems to notice. I work at the hospital with brain injury patients every day. Patients who think they're fine. Nothing's wrong. I can walk just fine when they can't. Or you tell them to sit up and they lay back, thinking they are doing it. But we wouldn't ever, as responsible caregivers, just let them go home to live alone when we know they need help. How is this any different than these people who have brain disorders from bipolar or schizophrenia that cause mental health problems? Why are we ignoring this situation? You know, the day that I was asked to come and talk here about our son, I come home and I saw the Journal and Courier headline stating, Lafayette had been voted the state's best community. Well, how can we be the best community and ignore our mental health care crisis? And yes, I said crisis. We have all heard how COVID has caused depression. Well, add these people to the list of patients waiting for a provider. And while you're at it, add 5 more people, because like a ripple in a pond, where Ian stood, now stands his 3 sisters and his mom and dad who need mental health care because of his loss, not including his aunts and cousins. If you leave here today and ignore what you have heard me say, and you don't find a way for funding, programs, change in laws, and other solutions to this problem, then you are responsible for someone else to find their family member taking their life. People who have a family member take their life are 65% more likely to take their own life. Then the ripple in the pond continues.
Thank you so much for that. I'm sorry for your loss. Okay, at this time, we'd like to give you folks an opportunity to speak. Start with whoever wants to speak. I'll just leave it up to you. Yeah, go ahead, Ron.
Thank you very much. I'm going to go first, if you don't mind. If my office contacted you, I got another engagement I'm supposed to be at here later tonight, so I'm going to have to leave, unfortunately, a little early. But let me begin by saying to the people here, I see we have a combination of law enforcement, of different branches, the sheriff's here, the volunteers in mental health, the justice, judiciary system, the judge in the back, a couple of them, obviously workers in mental health. I just want to sincerely say to you, thank you for what you do. For those of you who contribute your hard-working money to organizations like the Mental Health of America and others, it's greatly appreciated. It is a crisis, It's a terrible crisis. That's one reason why when I was assigned this summer in the Indiana State Senate as chairman of a summer study committee, I tweaked it and twisted it and turned it to study mental health, about 90% of it. Chris Campbell had a part to do with some of the other parts that was in that. And I decided to focus it all on that because it is a crisis. You got your head buried in the sand pretty deep if you don't think so. Immediately, believing the collaboration, I contacted people that's sitting in this room, as they know, including Zoe in the back. They wrote the recommendations that we make in the summer study committee that goes on to both the House of Representatives and the Senate. And I thought to myself, what an incredible opportunity for us to make a difference in mental health, to come out and make these recommendations. So with sadness, I sat here and read the North Central Mental Health and Substance Platform. And that's what we had in it, because they wrote it. The licensure, the telehealth, the workforce, some of the other Senate and House members come up with ways for additional funding. We studied these in depth and heard hours and hours and hours of testimony. I wish I would have known you, because I would have invited you to come down and speak. Because the end result, to the chairman's absolutely shocked, that the recommendations got voted down. I won't go into it, but it was politics. Politics and mental health. Unbelievable. And the chairman took every recommendation and put it in that bill of every Democrat and every Republican that sat on the committee. Every one I added. Because I knew the importance of getting this thing voted through. And Zoe and others were there. And to shock, I had some of my colleagues did not attend that last meeting for the vote because they had other things to do and they thought, you're not going to need my vote, this thing's going to sell through. And it didn't. That's why I wish I would have had you there, because maybe that's what needs to wake up some of these colleagues of mine, both in the House and the Senate, is to really hear what's happening out there. So I say to you, we'll continue the fight. I know it doesn't seem like we're getting very far, but there's one thing I have got in 24 years in the Senate. In order to get something through, it's got to be persistence, persistence, persistence. And it's got to be grassroots organizations and volunteers and people like yourselves that are here today that keeps on your legislators and other legislators, and particularly the chairman of health committees, both in the Senate and the House of Representatives, and informing leadership. We've got a crisis. We need to act, and we need to act fast. The decision makers. A lot of this we need to do right away. Don't need a fiscal on it. We can come back and do on a budget year the money. But some of this stuff we can do it quick, and we need to do it quick. So I went over my time a little bit. I apologize to my committee, but we spent the entire summer on this issue. And with disgrace, I tell you that I apologize as chairman that we didn't get it through. But I also will promise you we won't stop trying. Thank you again for what all of you do for being here this evening.
You want to look forward to that? Who's that?
I'm going to go out of order just a little bit, and that is, Ron, you made a comment about, I mean, your advice to us is what is one or two things we could do different to make something like that happen? Is there, I mean, what role do we play?
Well, now's a good time because now chairmans like myself and stuff are starting to plan agendas and bills for what we're gonna hear and what we're not. So the chairman of the bills that mental health will go to, we need to make sure that we have these items, and I'm sure we do, Zoe.
Yeah.
Right?
Oh,
On
yes.
the agenda,
Oh,
and we've
yes,
got
we
the
do.
authors set in,
Yeah.
right?
Mhm.
So now what we gotta do is beg for a hearing on it. And Zoe's an expert in the General Assembly. We have several here that spend a lot of time in the hallways. And we need to do numbers, bring numbers in of people and start pushing to hear our bill, hear it. Because that's the first step. In Indiana, the chairman plays a very important role because the chairman decides if the bill's going to be heard. Not the speaker and not the president pro tem in the Senate, but the chair. So we've got to get to the chair to get the bill heard. And then show up at the committee hearing, right? And bring individuals like this lady here to share her story, to show them what reality truly is out there, of not reacting.
Okay. Yes. I'll go. You know, we have come to this forum, or I've come to this forum 2 or 3 times, and we hear these stories. There is no doubt that the mental health issue in the state of Indiana, possibly the United States, I guess, or the world, is a crisis situation, and we're not devoting enough resources towards fixing it. Now, I commend many of you. I don't know who all is here, but you know, many of you are volunteers, and even the ones who are practitioners probably not getting paid what they should get paid for the background that they have, the education that they've gone through, et cetera, et cetera. I just have one question. We had advanced practice nursing that I thought we approved without the doctors overseeing that. Is that not the case? Did that not pass?
Zoe, you want to comment?
No, that has not passed.
Okay.
We
I
have
thought
put it, we have put it for several sessions and it continues to not pass.
Okay, I'm sorry. I thought we did. We should have, and we should.
So a question I have for you, Phil, then is, your perception is there is support for that idea?
Exactly. I don't know where it got hung up. I'm not on that committee that would hear that. But I don't think there's any doubt that there's need for this, and San 24 states are doing it. And it's working. We know that those individuals who are advanced practice nursing are going into rural areas and helping the rural areas much more than we could get, what I would call the psychiatrists are the more professional, whatever you want to do. I mean, the APPs are professionals as well. So, because we have a limited number of psychiatrists or psychologists that are out there, apparently not very many people are going into that job market. And I don't know, it's because of money or whatever, but those of you who are volunteering and those of you who are practicing in this area, I commend your efforts in that. And I would love to see at least that one little thing happen. That's a start. It's not going to solve all the problems, but we have to start someplace. Unfortunately, the pandemic has just accelerated this issue for the last 2 years now, almost. I think we've done that to ourselves, forced kids to wear masks, forced social distancing, and people need to interact. There's no doubt about that. Their mental health, listening to each other and listening to your friends and interacting with your friends, I think helps mental health. When you're out on by yourself, can you imagine what's what's going on as opposed to what's truly going on. So, I'm going on about nothing, I guess, but I think that we've done pretty bad things. One of the most interesting things that I just read today is that cigarette sales have gone up in the last year, first time in 20 years, which means that people are sitting at home, they're drinking, they're consuming, so their mental health is going downhill. They're not just doing drugs, they're doing tobacco and alcohol as well. We have to get a handle on that. First of all, we have to move on from this so-called pandemic or whatever you call it, and let people get back to their normal lives, what I call normal life. I think that will help our mental health issues a lot. But I've talked to several people before about, we spend millions and billions of dollars on incarcerating individuals. The majority of those people that are in there, I don't remember the number, they could have been helped with the mental health issue before they got to that point. We could go through the events of the last 2 or 3 weeks or month. The individual that ran over people in Wisconsin obviously has mental health problems. According to his rap sheet or whatever, they looked for help. Recommendations on how to help him over the last many years. We just had a young man in Michigan that took 4 lives, and it was all about mental health. So we talk about putting people in jail that we're afraid of, and I'm afraid that we're not addressing the individuals who need help to keep them out of that and to keep us safe in themselves. Safe here. So I'm all for spending money if we can find something that actually does something well or good for the community. We just need to reallocate our funding, our priorities. For some reason, apparently mental health doesn't come to the forefront for many of our legislators. We deal with a lot of different issues over the sessions of 15 years that I've been there so far. We talk about mental health in the hallways, but I'm not sure that I've ever had anything come to the forefront in any committee. So it's like Senator Altick said, how could that be voted down? I have no idea. People are not hearing getting the message, or we're not screaming loud enough for something. So I guess that's the point, is we just need to yell and scream and stop a little more than we have. So I truly believe they're supportive. If we just get people here. So that's why.
Yeah. Okay.
Thank you, folks, for being here. We have a very diverse crowd, and I'm very proud to see that. With judges, law enforcement, and folks who help all of our folks that are in crisis and have mental health problems. Let me say that I appreciate your testimony so much. I lived through sort of a crisis situation as a teacher with a young man, and I'm sure his parents wouldn't mind my saying, Justin Newell went through this and hung himself in his bedroom. It was crisis because he was in middle school at the time, and I was one of his teachers of English, and his dad, Jeff Newell, is very active in the community. His wife goes to Haiti to build habitat houses and does so many other things for people in this community. It has not stopped them from being active in the community. In fact, I think it has given them reason to share their work with certainly other folks, and they are working, as you are, to make a difference in the community, particularly in mental health. Let me say that The state is in good shape. I'm on the budget committee, Ways and Means Budget Committee. We probably have more surplus now than we've had in years. But we have to convince Dr. Tim Brown from Crawfordsville, I wish he were here tonight. John's here, that we can afford to do this. You know, we can afford to put more money. We can afford to put counselors in elementary school. When I was teaching at Miami School, we had a counselor full-time who worked with our students, as well as a nurse, Louise May. It was totally different. Now, you know, maybe a counselor is in 2 or 3, maybe 4 schools, or maybe the school does not have a counselor. And we need high school counselors, not folks that are planning their schedule in classes. That's what our counselors do, schedule classes. What we need is counselors that truly work with our students like Ian and make a difference and see what he needs. With that kind of background and talent, it's just heart-rending and heartbreaking to hear a story of a talented young man losing his life at that early stage. And I certainly appreciate your sharing that story, because that story probably will help other parents and young people. So thank you so much when they hear the story. It's a crisis when 60% of our psychiatrists are over 55. We have to give incentives to create a situation where our young people are going to choose psychiatry. They are paid well, but it takes many years to become a psychiatrist. And so we have to give them incentives, and we have to give them money, because when you're 42nd out of 50 states, you've got to react quickly. You can't just say, well, we're going to maybe do this, we're maybe going to put a little money here. No, this is a crisis. We need more psychiatrists, and I appreciate nurse practitioners being willing to go into areas where we don't have services. Thank you so much for doing that. We had 50% that you said, I think you mentioned that 50% maybe are not going to stay. What was that number in the profession that our nurse said?
So we have 50% of psychiatrists don't accept Medicaid payments.
That's it. Thank you. Those statistics that you cited, as well as the others, are very scary for a place like Indiana that has common sense. We kind of, pat ourselves in the back. Like you said, in our community, got an award. It's the best community at the Indiana State Chamber of Commerce. Several of us went there to hear that. But these problems did not come up. So I think you're sharing, so many of you from different areas, real estate, sheriff, judges, and incidentally, I'm proud that our judge, he knows it's coming, Dan Moore, was my student in 8th grade, because I taught him, right, Danny? I taught him. You have to take, credit for a little something, but Dan has compassion for people. He did as a magistrate and he does as a judge. Our judges are wonderful in this county. And I'm not putting Sean and other judges out. But did you notice that Judge Moore came up and spoke to you?
I know the family, Sheila. I taught Ian martial arts, and I've known Mark and Nancy and their kids.
Appreciate your doing that. And that meant a lot to see you do that. The little things mean a lot. And what we do for people and what we say to people and our reaction is going to mean a lot at the State House. let me say, as a member of the Education Committee, knowing we need counselors, and as a member of the Budget Committee, any program that you bring, Zoe, or the folks that are in mental health, I know Dr. Gisty's on your board. Come on down, Dr. Gisty. Because the background that many of you have, you know, in public service means a lot at the State House. It really does. And just calling or writing a letter, a personal letter, not just an email, a personal letter, really makes a difference to legislators. I think Bill and Chris will tell you that. I get phone calls at home consistently about problems, and I'm willing to have them call. It means a lot more than just kind of a quick text message. That's my prejudice now as a teacher. A one-on-one is very important to me. So just let me say that as a state rep, even though it's the second year of the budget biennium, they won't want to do much, Phil. Right, as
Well,
well.
we won't do anything because it's not a budget year.
It's not a budget year, but there are crisis situations that we need to react to. And if you notice, how many of you were at the parade yesterday? Did you notice the public service folks, our police officers, sheriffs and other folks were everywhere? And that's because of the Wisconsin situation. There were police officers walking alongside my car, and police officers over every alley situation. Just let me say that our folks are reacting. I'm very proud of our community and that they are, our law enforcement knows we have problems. So do our judges. So we need to put dollars and cents and not just talk about it. We need to move quickly and give incentives for folks, big incentives to do this, because people will react to dollars and cents, won't they? And if we help them and we allow Medicaid, I can't believe, you know, we have to wait 4 months on a waiting list. You're going to be terribly sick and you may lose your life. You know, if you wait 4 months, our young people are going to give up. You know, they're not going to wait 4 months for help. So let me just say, this is a crisis situation. I appreciate each and every one of you, and I will do whatever personally I can do. You know, as a Democrat, I'm not in leadership, but I certainly have been there long enough that I think they'll listen to me, and they'll know what we need out there. Like Senator Booth said, there's a knowledge there. We just have to push into that, right, Phil?
This is not a partisan issue.
It's not at all. It's not partisan. So I feel like we can make a difference. And thank you all for your testimony. Thank you. Thanks a lot.
Thank you so much for having us here again. I always appreciate the knowledge that you bring to us. Thank you, Nancy, for sharing your story. I'm so deeply sorry for your loss. No parent should ever have to go through that. I have a friend who also lost a friend a few years ago, and it's just, I don't even want to imagine what that pain would be like, because it's just unbearable. And no parents should ever have to go through that. Yeah, a couple of years ago, we did have safety legislation that went through, which we added mental health counselors to schools. We wanted mental health counselors added to the schools. Unfortunately, that was removed from that safety bill, and it was put in a separate bill that didn't have funding. Right now, of course, we're pretty flush with funding with all the federal dollars that have come in. We were able to use those federal dollars to increase money in our schools to be able to give teachers raises this year. And now they're talking about tax cuts next year. Those federal dollars aren't going to be here in 2 years, so I don't think that we're ready to be talking about tax cuts. But we really should take this opportunity, if they're even thinking about that. Mental health reimbursements have not been changed since the 70s. And many other medical Medicaid reimbursements, I know ambulances, several hearing aids, so many things have not been updated. We barely meet ends meet when we're talking about our Medicaid people, and of course enrollment has been increasing a lot over the last couple of years with COVID. So we really need to look at those dollars and find ways during, and that of course has to be done during a budget year, which we just had. So I'd really like to see that we look at how we can make that happen. I'm on the Medicaid Advisory Committee. So I'm hoping that that is something that we look at addressing in the future so that we're not just, we're using the revenue that comes in efficiently. And when you don't invest your dollars in mental health, it ends up, you know, eating away at the rest of our state. The jails are filled, Bob can tell you that. You know, and that's happening across the state. Of course, you know, we have a lot of substance use. People are self-medicating, so we're not addressing the issue. The war on drugs needs to end, and we need to realize that it's the war on mental health needs to happen. We need to actually start addressing mental health. When people are forced to self-medicate, let's not just arrest them, let's treat them. And let's find ways to fund that. Let's find ways to, if we could increase funding through reimbursements, maybe some of our psychiatrists will start to accept that, to become providers of Medicaid. And that is, again, like I said, not just mental health, but several areas. A lot of people, a lot of our medical professionals don't want to be providers for Medicaid because we really haven't looked at those reimbursements for many years. So we need to address that. You know, I so appreciate so much that has happened in our community. I know we're adding mental health services in our jail, which I think is really going to help us. And I know that there's been a great collaboration of our mental health people in our community to find ways to not just arrest people, but to get them to care. I'd like to see that across the state. And I hope that that is something that our community becomes a role model and that it expands not only across our state, maybe even across the country. Hopefully that will become something that becomes more of the norm. We need to get away from the ideas of, you know, the war on drugs and start to address the actual real issue, which is mental health. So again, I appreciate everybody coming out. I appreciate the education that you give us, and I hope that as state legislators, we can do as much as we can to encourage that funding, to bring back that information, to encourage, to educate our colleagues, and make it a priority in our state. Thank you.
John Fry, County Commissioner of Montgomery County, 38,000 folks in our community, $340,000 we contribute to Valley Oaks, our mental health service provider. The state kicks in another $1.6 million on our behalf, so a couple $1 million spent on behalf of our county. I do know that mental health is a huge deterrent to our communities being vibrant and healthy and growing. Wasn't much said. She had the one stat on there about substance abuse. That really is what drove me to be on the Valley Oaks board to try to influence that board to bring more services home to our county. In our jail, 91% of the folks in our jail are because of substance abuse of some form, whether it's theft or use or 91%. 73% recidivism rate. There are programs that, I guess I'm not going to blame the state legislators for all of our problems. There are a lot of Fed regulations that you guys can't control. One of those, we have a JCAP program in our jail. We have 200 beds. We've got 15 students out of 200. And I told you 91% are in there for mental health issues, drugs. Fed regulations control what kind of service our mental health board can give to our inmates. So there's a need, and it's a no need, but there are regulations keeping that from happening. You know, it boils down to staffing and having enough people. We talked a lot about that. You talk about Fed regulations. We're going to lose 20, if we haven't already, 20% of our staff at Valley Oaks for the vax mandate. That's not we didn't initiate that. So we're already short-staffed, and we're down another 20% of staff. A little bit of good that's come out of this, I think, and really educate a lot of people is telehealth. I talked about, the delay in getting help. The delay, that's quick. I mean, that, I don't know what percentage, and, these guys could talk about how much growth we've had in telehealth. But wow, that got people immediate, and some before they got too bad, and that's huge. So there was some question about how that was funded. In fact, it continued to be funded if it wasn't just under this pandemic, and the state did change some of that regulation, so we can continue that program even outside of the pandemic. So I wasn't planning on being up here speaking. I was here to learn just as well, but I was asked to give a little bit of perspective of the county government side to this, and I'm here to take more back to our county and make our community better too. So
Tell Tim Brown, we missed him.
Since you've talked, I do want one question, or I guess a concern. I mean, this is not a budget year. So the new budget year, you'll have, of course, Senator Boots has decided to step down, and a number of your colleagues have as well, as I understand. Yeah.
Dr. Brown.
Yeah. So basically, we're talking about, you're already trained, so the next people, it just seems like there's a big job coming up trying to get to where we need to go with the new group of people. Am I overstating that? Or?
I don't think that mental health might have been in the shadows in the past. It's no longer in the shadows. And this pandemic has done nothing but put the spotlight on it. So I don't think anybody can say that it's not a priority. If it wasn't, it sure is today.
Well, it's our duty, I guess, as outgoing legislators to make certain that the ones remaining are aware of what's going on. So we just don't melt into the woodwork.
Right.
So we'll tell them they need to do something. And I've told everyone I'm not going to want them if they don't do what I want them to do.
There you go. Okay.
I think also just from going over to the State House and testifying is, this pandemic has kept folks from being able to go over there. I mean, you go in there with 500 people and now you don't, or didn't last year, so, it was a different environment completely when there weren't crowds of folks there, in my opinion, of what I saw.
Some people hesitate to come.
Sure.
They're getting there. You want us to answer questions?
She's formulating the question.
Okay.
Okay, this is a question. Okay, what will it take to get more sustainable funding, not grants, for mental health, substance abuse services, including reimbursement? People will not join the workforce if we can't pay them what they are worth.
I agree with that. I think they have to form a group, have a petition, and be there personally. I know it's very difficult to do that, but I know the teachers came, read for ed and so on.
Oh,
You
okay.
know, there are certain things that you can do to say, you know, this is a crisis and we're not going to stay in the profession unless you listen to us. So on. And I think, you know, we're going to have to threaten folks that we're not going to have
What was the word you
anybody.
used? Threaten? What did you say? We need to what?
Threaten.
Threaten. Okay, that's what you said.
Well, you know, when I say that, I
Figuratively
mean,
speaking.
leave the profession.
Yeah.
Well, teachers are leaving the profession.
Right.
You can see that every day. We've got substitutes teaching classes. I never thought I'd see that happen. And I think we have to say, look, our psychiatrists are getting older. We must give incentives for nurse practitioners that will major in this area, mental health, nurses, that you have provided information tonight. I think we have to really sincerely give incentives and pay raises to these people for the toughest job, I think one of the toughest jobs we have in society.
Well, I don't know how many other meetings are going on in the state of Indiana. We're 4 legislators.
Right.
We're not gonna make a lot of difference. I mean, there's 150 people over there. You've got to get to
That's what.
over half of those people to get anything done. So I'm saying that you need to have more of these meetings throughout the state. And I commend you for putting this together. I think you formulated this forum a few years ago. I don't know if that's going on across the state or not. I go back to the same thing that I said when I was speaking earlier. I don't hear a lot of clamor among my fellow legislators that we need to do something about mental health. I mean, you know, Zoe comes over, there's other NAMI people that are lobbying, but, you know, without personal testimony, you know, how does this really impact us? Because mental health, you can't tell who has a mental health issue. I mean, if I have a broken leg or a broken arm or you know, scars, I know how to fix that. And you can see the difference. Mental health is a totally different thing. You don't know if you've made a difference or not. So I'm just saying there needs to be more meetings like this. I know that, you know, we have that the program in the jail in Montgomery County. Boone County has a similar program. The Attorney General started that in Montgomery County, came up with the funding to you know, try to help those individuals. Because I know that you know, you go into jail and maybe the drugs are not there, maybe they are, but as soon as you walk out, within 5-10 minutes, you can be back into the habit easily. So you have to get to those individuals. But my point is, more legislators need to know that this is an issue, that this is a crisis, and they need to address it. Because I can tell you that when it comes to the forefront and everybody hears from them, they react.
Let me suggest public service announcements. I agree. When smoking was an issue in the early 80s, Yul Brynner came on and said, folks, I have lung disease. I'm going to die in a month. Please listen to me and stop smoking if you're a smoker. Do any of you remember that in the 80s? It worked. You know, my 3 kids just were absolutely, if they saw a restaurant had smoking in it, whether they liked the restaurant, they wouldn't go in because of that Yul Brynner public service announcement about dying with lung disease. I think we have to have people in public service announcements like you did, saying what a crisis we're in, and we need to save our children. I think we have to have PBS, we have to have public service announcements in order to share that and get it out with people, because, I know Zoe can come to the State House, but not everybody can. They're busy working. So.
I work too, Sheila.
And that's your job, though. If it's your job to come and talk to us, which it is, then that works. But not everybody, unfortunately, can come to the State House. So we've got to have some way of getting the word out that we're in a crisis situation.
I feel that we're very aware that mental health is a huge, enormous problem in our state. I think the issue is that we have not made it a priority in our state. I think people get distracted by other issues that they think are more important, but when it comes down to it, this affects every part of our state. It affects all of our budget. We've done a really great job at building up that surplus. We're now at the maximum. And again, I've heard that there are talks of cutting funding next year. Instead of talking about cutting funding, we really need to now, if we're flush with money, let's put those dollars in the most important thing that's really going to impact and make a huge difference in our state, and that is mental health. When we don't invest in mental health in our schools, we see what happens. Mental health, if you have a parent with substance use, that's affecting that child's life in performance in school. It's affecting Department of Child Services. It's affecting it's affecting our jails. It's just affecting so many aspects and costing our state so much more money, that if we made that investment, we did that prevention, we did that, give mental health the care to those in need, and to do the long-term care that needs to happen. These people, they may as well have diabetes or heart disease. This is a lifetime illness that they are going to suffer with for the rest of their life. We need to understand that. Not only understand that, we need to make it a priority in our state. I think that we need to, if you're from other parts of the state, please contact your legislators. Tell them that this is a priority for you and that you want this funding to happen in our state. And we need to invest our money in the right ways. We can always save money in a surplus for a rainy day, but it's pouring out there, guys. We need to invest now. Otherwise, we're constantly going to be chasing after this and never making a dent.
We have a $3 billion surplus. And
Yes.
with the surplus, with the American Rescue Plan, it was up to $4 billion. Now, you won't hear many legislators say that.
And I know that a legislator, when they were in caucus deciding what to do with those federal dollars, they said, let's put some in mental health. And I know that they put that $100 million in grants, and I hope those dollars they never did get out. That's really disappointing. I heard earlier, towards the end of the summer, that money still had not gotten out. I don't know where that $100 million is or why it got held up, but I know that Representative Tom Saunders said that was where he wanted his dollars to go. And he lives in a rural area in southwest of, or southeast of Indianapolis. So he even knows out in the farmlands that mental health is a huge issue and that we should be investing those dollars.
And
So
unfortunately, he's not running again, so he has to say it now.
yes, well, he's assured us that the person he has that he wants to replace him is going to be just like him. So, but so hopefully, if you know people across the state, please encourage them to educate their legislators. I'm an audiologist, and I've even told our state organization that, this is the model. If you want to educate legislators, get them together, show them where you work, let them see firsthand what's going on and why this is so important. When I went door to door in 2018, I quickly learned that mental health was a huge issue, not only in our community, but in the entire state. So I definitely am aware and am fighting as much as I can to raise that awareness among my colleagues and to make it a priority in our state. But we do need your help. We need you to let the other legislators know. And when we're talking about where those dollars should be going and how we should be investing them, we need them to know that mental health should be a #1 priority. So thank you.
Chris and I are both on budget, and Dr. Brown, good friend of John's, is chairman of Ways and Means and is a doctor. So we will work with John and others to do that. Bill, over in the Senate.
Okay, we got some interesting questions here. We'll see how. Can we offer state grants to students who want to get into psychiatric school? Simply offer grants for students to encourage them to get into psychiatric mental health.
Absolutely. I think that's the key. As I mentioned that first, incentives for those folks, nurse practitioners also, to go into that area for sure.
And I know that there are grants for education. If you're gonna stay in Indiana, they do offer funding available for those students as long as they agree to stay in our communities. I think that's a fabulous idea. In addition to that though, if we're gonna do that, we have to make sure that it actually gets funded.
Well, the other thing though to keep in mind with psychiatry is even if we got 1,000 students in Indiana to go into psychiatry, Congress at the federal level only allows 1,094 students to enter residency each year.
Oh.
So it doesn't matter how many we get to go, they're still limited at the federal level. However,
So we have.
here's an idea. Sorry, I got very excited, I apologize. Here's an idea. What if we offered reimbursement for education to become a therapist, to become a licensed clinical social worker, in exchange for 5 years in a school?
Tax credits?
No.
No,
Here, if you go to school, you become a licensed therapist, you become a licensed clinical social worker, and you agree to work in a school in Indiana for 5 years, all your student loans gone. That's how you build a workforce for the schools.
Absolutely.
That was. Write that out and we'll present that as a bill.
Absolutely. And you
We
could
got
probably
from
use
December
education dollars for it too.
What was your last comment?
I'm sorry.
What was your last comment?
Oh, I said you could probably use education dollars too, because you're providing something for the schools. Yeah.
Okay.
Can we open up the-
We'll talk to you. So. Great idea.
This is another question. Do you support allowing mental health professionals from other states to practice in Indiana, and they put in parens remotely, without licensure here to help with the increased demand, particularly with juveniles? I have a question mark there.
That's another regulation.
Yeah,
I
for me.
mean, you've got a trained
Yeah.
and experienced doctor that can't come practice here.
Can right now under COVID.
Reciprocity, we should have, no doubt about it.
So I think that's what Senator Alden was talking about. They did a summer study committee and they were talking about reciprocity versus compacts. Many professions, including my own, I know nursing, and several other professions are forming state compacts that allow, it makes it a little bit easier for somebody to become licensed more quickly. Because if they're licensed in another state, they've already been, it's already been evaluated whether or not they meet certain criteria to make sure that they're, have a certain education and ability. So they've already been vetted, basically. I know that the reciprocity versus compacts were discussed, and I know that the compacts were approved. And legislation next year should be passing compact legislation, which Tim Brown had been opposed to because he doesn't like compacts. So this is great news because, you know, it'll make it a lot easier for people, especially in border states, where they may be working on one side of the state, but they don't want to, you know, it's too hard to get licensed in the state next to them, so they could be working at both states at the same time. So this is a great thing, that they, but the reciprocity language, I think, still needed some work. I know that was a preference for Tim Brown. I think one of the issues with that caused hesitation was, you know, with the compacts, it's already established, okay, they've met this certain criteria, that it's okay to license them. With reciprocity, there may be some limitations to that. So I think there's still some work that probably needs to be done as far as reciprocity. But Zoe probably knows a little bit more about that.
Another question here. Is it normal for university students who need mental health services to be told to come back in 2 to 3 months? What can you do for this? This observation, a doctor has specifically said there are not enough psychiatric residences, which of course we've already talked about. Back into 3 months. I don't quite understand the question.
This is happening in university settings, is what's
Apparently,
the person is saying.
Yeah.
So the question is not just university settings, specifically say with Purdue, the situation is students being told to get higher level services somewhere else, such as Valley Oaks, Sycamore Springs, Willowstone, and they're then told that, well, they can get those services in 2 to 3 months. And this has been something that the person that asked that question specifically commented had been going on for at least a decade when her youngest child was also in Purdue. And so she was asking, what do you think could be done to try to remedy that?
It's a good question.
Well, and I think one of the things that we can do is work on, you know, language that helps us get people licensed sooner. I think we've got some great ideas. I think we should have some grants or incentive programs to get people, help them to get their education, if they're willing to stay in our communities, especially if they can go serve in those rural areas where it's more difficult to get to. I know we also expanded telehealth. One of the things that we were trying to do was also add telephone to that, which we got, did not get through because we did find I was informed that we were able to reach people in those rural areas, elderly people. Obviously, there's not internet everywhere, so being able to expand that telehealth to include possibly telephone, especially for counseling, I think is something that we should still look at again to see if we can continue to expand that. I know that last year, just expanding the telehealth, we were having a hard time getting it expanded as far as we wanted to all the professionals out there that should have access. But we need to continue to work on that to educate those legislators and to let them know how important that is and why we need it.
And we need to react to the 2 to 3 months wait. You know, a student can be very ill and not be able to wait that length of time with mental illness that is reoccurring. So we need to move quickly.
Yeah, I kind of feel like it's a lack of providers. Seems like the issue. We need more providers and we need to find a way to encourage people to go into the fields. And we need them, more people probably to go into the field because, you know, with a limited number, their caseloads are probably getting pretty high and the burnout rate. We don't want them to burn out and to quit altogether.
They're already quitting, they're already burning out.
You don't have to wait for that.
I know.
The quality of care goes down as caseloads go up too.
Oh, of course, yeah.
Okay, I have another question, but it's from Joe Venable. Now, I'm gonna ask you to ask the question, Joe. You know why? Because I can't read your writing. So that's the question.
The question revolves around funding. Often when I talk to a legislator about helping with treating mental illness in the state, they say, we'd love to, but we can't find the money. Do you realize how much money the state is spending on mental illness and wasting it in our prisons and jails? You know that according to a calculation I made, a stay of 60 days in adult prison would pay for an average psychiatric hospitalization that would serve to get a person on the right track to being a productive citizen. In a youth situation,
I appreciate your background.
less than a week
You worked in that area. I know.
in
And you're right.
youth, would pay for their treatment in the hospital. That money's being spent. You need a paradigm shift to spend it on something that would be productive. You're wasting it now,
Yeah,
wasting tons and tons of money.
we need you to say that in the budget.
Making the right investments will save us way more money down the line. You're absolutely right.
You're right.
Having somebody go in and out of jail, is, and, not helping them become a productive citizen who are paying taxes and, building up our revenue is way better of an investment than just putting them back into jail over and over again.
You're exacerbating the situation. You have a recidivism problem where they don't usually have a life sentence. They're out in X number of months and they're back in a month or two because they're sicker when they leave than they were when they got there.
I'm sure Sheriff Goldsmith knows those faces pretty well after a while. Right, Bob?
You're gonna have to send Bob to get a degree in psychology.
Any others?
Just one more. I don't know if this is, you can decide if you want to respond to this or not. How can we as community mental health centers assist in bringing together the representatives from our areas to have more synchronized voice on these topics?
How can we get them here?
Yeah.
Oh, you want to come here?
Yeah.
Well, I think we could do Zoom,
Okay.
We've definitely become pretty accustomed to these Zoom meetings. But I think, if we could also organize these events across the state, I think a lot of legislators will show up, especially if we feed us.
Usually Brian Buchanan comes from Lebanon.
Yeah, he was on.
I think Chris is right. We probably, I don't care for Zoom myself, particularly for mental health. I want to speak to you personally, because you'll say something to me, maybe person to person you wouldn't do it for Zoom. With other folks listening. But I think more meetings like this.
Right.
This generated a lot of different ideas with a lot of different people from different community settings. Education, law enforcement, lots of areas. So I think more meetings like this are necessary.
At this time, thank you for addressing the questions. Appreciate that. This time I'm going to turn it over to Zoe for our forward action.
There's a question you didn't ask, Ken, and I want to ask it because everything is partisan in this day and age. And if one of the two parties isn't supporting mental health, which one is it that is holding things up? So those of us who are voters, because the thing we can't do is we can vote. We can vote people into office who are going to support mental health. But if we don't know which party it is that's the problem, that makes it difficult for you to even think about that.
I think I said earlier, it's not,
I was
it's
gonna
not a
say, I
partisan
hope
issue.
it does not become political, honestly. But you can judge for yourselves whether that legislator is reacting to what you're asking. I mean, that's
The reason I
personal.
didn't ask that question, Jason, is because you asked me for Ron. Ron wasn't here. I figured I would ask him, I could ask him prior.
That's okay. I know that these legislators are very supportive.
Right.
But it would be helpful to know which legislators want to support mental health, so that we can get that word out and change.
Yeah, but I think one thing we learned from them tonight was just this idea of having these kind of get-togethers in other areas would be probably pretty helpful because, hopefully, it moves, as you participate in these, it moves you from one point to another. And that's really what we need to have, see being done at other places as well. So,
And I have to say this, because I'm a little prejudiced for Tippecanoe, but you see the different types of people who are here this evening, representing all kinds of businesses. I'm hoping that could happen in other counties.
Right.
Because
Sure.
this is unusual. Law enforcement, the judges and
Right.
other folks that make a difference on boards, educators. This is really a special area that does that. But we can promote this, what happened here in other areas. I think that's what we need to do.
All right, so I'm here to wrap us up because we have just a few minutes. So for those of you who have not had a chance to meet, my name is Zoe Franz, and I have the honor of chairing the North Central Legislative Forum, which is a collaborative effort. Those of you who are involved in this committee on a regular basis, can you just raise your hand to show the importance of this group and the representative? And so we meet. And this really started under this man's leadership. He's too modest to ever say that, but Ken here, our moderator, started this group a number of years ago, and I since have been able to chair. We do this forum and we do a June legislative tour that a lot of you participate in. And so as a result, we put policy into action. And so all of you have a call to action that has each of our legislators in the North Central region listed on here, emails and phone numbers. And so what this call to action says, to follow up with some of the things we've talked about today, is we need to return telehealth standards to what it was like during the COVID pandemic. We've heard from all of these representatives up here that we saw improvement to access and we saw improvement in services. And that is specifically around our peer recovery coaches, which I know some are in the room tonight, as well as our skills therapists and case managers within our community mental health centers. As of July 1, we are not allowed to do teleservices because that was overlooked in the legislative session, and it has impacted services and have increased workload burden. So we need that change, and there are several bills, there's about 4 of them that will do that this session. Please keep your eyes and ears open for it. Please put a voice to it and reach out to these individuals to say that that's needed. We also need to support behavioral health workforce development. Some of the ideas Dr. Nicole Adams shared, but loan forgiveness for mental health and substance abuse treatment providers, that was done legislatively a couple of years ago. The funding just stopped for it. So we need to put the funding back to it and get providers back into our area. And then maintain funding and parity for behavioral health and addiction treatment. You will hear of a bill, I think it will be moved forward by Representative Claire's office, you will hear of a bill of a cell phone tax to pay for 988. 988 is going to be the mental health crisis response system in the state. And I know when we hear the word tax in the state of Indiana, we shut down. But this is a tax that we need to put our voice behind so that those who need access to mental health services can have it. And so that bill will be moved forward. We also need to rebalance Medicaid and also support, you will hear Representative Vermillion has a wonderful bill to plant the seed for community behavioral health, comprehensive community behavioral health clinics. This is a federal initiative. And what this does is it changes our system to be value-based on a prospective payment system and not for fee-for-service. Fee-for-service is in the 70s and our costs continue to be in the 2000s, right? So prospective payment system, comprehensive community behavioral health centers, that is a bill that Ann Vermillion is paying for. So all of your representatives are on here, and I'm talking to all of you and all of you online, the 32. So total, we have about 100 people that have tapped in to hear all of you speak, and then to also hear this call to action. If one of you made one call to someone on this list to say mental health matters, it's going to make an impact this legislative session. Yes,
So
it is my
where's
job.
Vermillion from, please?
Vermillion is from Blackford Grant area.
Marion area.
Marion, yeah, yeah, and she has a wonderful mental health bill that she's including a lot of this in. So just please keep your ears and eyes open for that bill and put your support. So thank you to everyone who came tonight. Your voice matters. Please reach out to these people on this list. You have that online as well. If there's anything that the legislative forum can do, please reach out to any of the members here so that we can make sure your voices are heard. We appreciate all of this. We appreciate your time. Thank you, Ken. You want to say some closing remarks and then we'll.
Just one closing remark.
Yes,
I just
absolutely.
wanted to actually thank Zoe for providing leadership in our group over these last few years.